Hey, Dano here. It is April the 6th, the day after I had put out a podcast slash video of information concerning the COVID-19 virus and why it was not really related to 5G towers. So, following this line of thought I got to wondering, when exactly did this little bug first make its appearance on the scene in this world? Well, it turned out that the very first case, you'd have to go all the way back to November 16 of 2002 when the CDC reported the first case of an atypical pneumonia that was discovered in the Guangdong province in southern China, a province that has a neighbor right to its north that is, guess what? Hunan, China. Wow, what a coincidence. So these guys are not too far apart. The source of the SARS outbreak near Hong Kong, where I believe they killed an awful lot of chickens. I may have that confused. But anyway, back in the 16th of 2002, the CDC, Centers for Disease Control, became aware of a problem. Okay, and so by March 15th, the CDC had issued a health alert notice for travelers to the United States from Hong Kong in the Guangdong province. I hope I got that right, in China. So it's just interesting to notice these are both coronaviruses. They're closely related, with the difference that particular version of the virus, which did get into the United States and did impact. See, March 24th, the CDC laboratory analysis suggests a new coronavirus may be the cause of SARS in the United States. 39 suspect cases to date had been identified, and of those cases, 32 of 39 had traveled to countries where SARS had been reported. Okay, and then of course this timeline goes on through April and May. We had a number of cases globally. And by December 31st of 2003, globally, WHO received reports of SARS from 29 countries and regions, where 8,096 persons with probable SARS infections that resulted in 774 deaths. In the United States, 8 SARS infections were documented by laboratory testing, and an additional 19 probable SARS infections were reported. Okay, so this bug has been around for quite a while in one form or another. And I think the only difference that we've been told is that this current COVID-19 or SARS-2-COVID virus is much more infectious than what we saw way back in 2002, 2003. All right, now, here's my question. Is that really true? Is that really true? I cannot help but remember back in December and January of the previous months, where I would be sitting like at a local watering hole or whatever, talking to people. And I can remember this distinctly because I'm paranoid about getting a cold anyway. But hearing these people say, yeah, I've had this really bad head cold, coughing, sneezing, I feel terrible. And one individual told me he'd had it for a number of months. Wow, okay. Some of these people had gone to a doctor, and the doctor said, well, it's not the flu. It's probably a head cold, probably one of these bad rhinoviruses going around. And that got me to thinking, well, perhaps, the SARS infection in the United States had started much earlier than what we have been told. Maybe it started back even in August, I don't know, and had spread among the young population like wildfire, because young people they've begun to see are showing little to no symptoms, even though they're infected, and even though they're spreading the germs, the virus all over the place. Perhaps we have a lot more people who have became infected early on, with the ones that did show up at the doctor's office being tested for flu because no one suspected anything else, coming back negative, and so the doctor writing the diagnosis down as a common cold or a flu-like cold, whatever. So what does that even mean? If the virus, which is highly contagious, did start spreading much earlier than anybody suspected, then perhaps millions of people got that infection and were running around infecting others. And only when we began to suspect the bug for what it truly was, and only when we started testing, have we begun to develop the scary statistics that we're seeing today. Okay, so in other words, okay, what does that mean? It means if I was correct and literally millions of people had been and are infected with the coronavirus, then the good news is that the rate of those dying from this infection is vanishingly small. It's really not the problem that we thought it was. And then maybe what we're doing procedurally is exactly back assward. Maybe instead of quarantining the entire nation, we quarantine people who are old, obese, have secondary complicating conditions. Maybe those are just the people we need staying in their homes and wearing masks, et cetera, et cetera. Because honestly, if what I'm saying were even vaguely true, then this is a nothing virus. It's a lot less effective or lethal than the common flu that we kind of tolerate and go around our business and have done so for decades and decades. I'm Dan-O, and that's it. Be safe, stay healthy, and don't believe everything you hear from old people.